Hi, good afternoon. It is currently Tuesday, August the 22nd. We are on crunch time for the upcoming event, Low Carb for Better Health. It is this Saturday at Montgomery Bell State Park. I hope you have in-person tickets. If you do not have in-person tickets, you can still get access to all the great information, and that's through a virtual ticket. Virtual tickets are on sale between now and Thursday, I think at 5 o'clock. So if you do not have an in-person ticket, go get a virtual ticket. We want you to have this information. We want you to join us. And the good news is even if you can't watch live on Tuesday or Saturday, sorry, I don't even know what day it is anymore. Even if you can't watch live on Saturday, you can watch the information anytime, whether it's 2 weeks from now or 6 months from now, you're going to have availability to watch that. So if you don't have in-person tickets, go today, tomorrow, or Thursday morning and get that virtual ticket for Low Carb for Better Health. We've got some great speakers coming up. You can probably see the agenda poster here in the background. Remember, we've got the Berries, Ken and Nisha. We have Dr. Eric Westman. We have Autumn Weathers, Jennifer Williams, and Craig Emmerich. So good times. I can't wait to have it. So today I want to take just a minute and talk about diabetes. And I'm going to present a short little study. It won't take as much time, but in general, there's two types of diabetes. Both of them come from dysregulation of insulin or problems with insulin. But type 1 is where your body does not make insulin. So you have a pancreas, your pancreas doesn't work. You do not control your insulin. Now, oddly enough, most of the time, these people are very thin. They can't store body fat because they don't make any insulin. They pee a lot. They're very sickly. They get sick very easy. Type 2 diabetes is still a dysfunction in controlling blood sugar and a dysfunction in insulin, but it's different. Your body actually makes a whole lot of insulin as a type 2 diabetic. It honestly just makes too much, and it doesn't listen to the insulin it does make, and so you become insulin resistant. And what does your body do when it's insulin resistant? Well, it yells. The pancreas starts yelling, and it makes more insulin. So then you've got an overabundance of an overabundance. You store a whole lot of body fat because insulin is just stimulating that storage of body fat. So both bad situations. One is very acutely life-threatening. Type 1 diabetes is a life-threatening condition, and unless it gets controlled quickly, can lead to death. Now, before we had medications to control, before we had insulin, believe it or not, there was a time in the US history and the world history when we did not have insulin to control, and these people need it. They have to have it to live. There was short lifespan. People didn't live long with this, but some people did live longer. And the only treatment that we had at that time was a dietary intervention, which is the low carb diet. So before we had insulin, we put people on a very, very low carb diet. They had a lot of fat in their diet. They had a little bit of protein. And that was really the only way that they were able to survive more than several months with this condition. Still wasn't a great scenario. Your body does need that amount, but at least they were able to survive a little bit longer. Type 2 diabetes, it came along later, and we initially used a low carb diet for it. We didn't have a lot of treatments for it. There, you actually may have heard or maybe haven't. The Banting diet was one of the very first diets to work on reducing weight loss, and he started using it in his patients and also noticed weight loss and more better control of their sugars or glucose urea, because the only way they had of measuring diabetes at that point was knowing that there was sugar in the urine. But it was a low carb diet that approached that, and that was our treatment for type 2 diabetes. Now, in our clinic, we see type 2 diabetes all the time. I have a small population of type 1s, but larger population of type 2 diabetes. And we've seen the type 2 diabetics improve their blood sugars, improve their glycemia. Actually, some have reversed their diabetes, or we can say put in remission, because if they stop eating the diet, they stop eating the protocol that we give them, their diabetes comes right back on. But we're able to take them off of pharmaceutical medications, take them off of drugs, and just rely on diet many of the times. And sometimes they get to the point where drugs are required because their pancreas is burnt out at that point. But a lot of times type 2 is reversible through diet. But after the discovery of and the use of insulin, the diet in general intervention for type 1 and type 2 kind of went away. We started using medicines and saying, here's this medicine, you can take that, you don't have to worry about what you eat. And then it has just kind of progressed from there to the point that now the diet that we used to say was the only treatment to save your life in type 1 diabetes, is actually dangerous in type 1 diabetes. And that is what we get a lot of endocrinologists telling patients, is that this diet that was once life-saving and the only thing that could save you is now going to kill you. You need to take this medication instead. The main fear, and the reason it's controversial, is a condition called diabetic ketoacidosis, which is basically when your blood sugars are too far out of control and your body is overproducing ketones, and it makes you very sick and starts shutting down your body. They thought if you put some people thought, I never thought it, but some people thought if you put a type 1 diabetic who is already at risk for diabetic ketoacidosis because of the severe out of control blood sugar, if you put them on a keto diet that produced ketones, they would automatically be more likely to have ketoacidosis. So therefore it was dangerous. But this was never studied. It was never researched to prove that it was unsafe. And recall, this was the only way we had of saving these people's lives, or extending their lives, before we had drugs. So there is this movement now in virtual world and across the world in general of starting to bring back and use the low carb diet to better control persons with type 1 diabetes, and then to really help the people with type 2 diabetes. But at this point, we have to backtrack and get research to prove that it's safe, even though we used it before. And that's what this paper is that we're going to talk about. And it is a research study. It is a very small research study. It was done in the UK, and I consider it more of a proof of concept kind of thing. Let's prove that we can study this, and it might not be as dangerous as everybody thinks it is. So the title is Type 1 Diabetes and Low Carb Diets, Defining the Degree of Nutritional Ketosis. It was done in the UK, and it was done on patients who had type 1 diabetes who self-selected to try a low-carb diet. So this wasn't suggested by their provider, wasn't suggested by anybody. The patient did their own research and said, all right, I want to do a low-carb diet. Well, these researchers came along and said, well, let's make a study out of this and let's follow it. If you're going to do the low-carb diet, that's what you're sold on. Let's do this. Let's do this anyways. And so there were 15 subjects in this study. And they were divided into 3 categories. They were divided into a very low carb diet, a low carb diet, and then what they call unrestricted regular carbohydrate control diets. So think about the American Diabetes Association diet. Maybe restrict your carbs a little bit, but you can really have as much as you want to. The participants in this study, it was only a 3-day study, so it didn't go on very long, which honestly I think helped for compliance. They had to keep a 3-day diary of everything that they ate. They had to record that. They had to document all of their food. They had to check their ketones, and they also had to check their blood sugars every day and keep up with that. So to be in the very low carb diet, you had to consume under 50 grams of carbohydrate a day. Now, pause there. Under 50 grams of carbohydrates will get some people into ketosis. It will not get everybody into ketosis, but for the terms of this paper, that was what they used as the very low carb diet. To be under just a low carb diet, it was consuming between 50 and 130 grams of carbohydrate, which is way less carbohydrate than the standard American consumes today, which is around 300 grams a day. So it is very much a reduced carb diet. And then those that were on the regular carbohydrate control were anyone that consumed greater than 130 grams of carbohydrates in a day. When you were looking at their ketone levels, and so that's what they wanted to watch. They wanted to watch the ketones to see if the type 1 diabetic, if they went on a low carb diet, where did their ketones go, and did it go into this dangerous level that we're worried about? So the people who were on the very low carb diet, under 50 grams a day, their ketone levels were 1.2. The start of where we would even start getting concerned for diabetic ketoacidosis is 3. Much lower, but typically it is even higher than that. You're looking at 5, 6, 7 or higher for those ketones. If the people were on the low carb diet between 50 and 30 grams or 130 grams of carbohydrate, their ketones were 0.3. So we're in ketosis, but we're barely in nutritional ketosis, which is a state that your body makes ketones for fuel instead of burning sugar for fuel. And if you were on the regular eat what you want carb diet under over 130 grams, your ketones were 0.1, which is really considered almost not making any ketones, pretty much not in ketosis. So what they concluded is that yes, the very low carbohydrate diet produced a higher ketone level in type 1 diabetics, the ones that they studied. However, it was significantly lower than that would meet the threshold for diabetic ketoacidosis. And so they propose that this could be a very safe intervention to help reduce the reliance on medication And because they proved the concept that it can be very safe, it is worth studying and doing a larger scale interventional study. And I would 100% agree with that. We need to do a larger scale interventional study. If you have type 1 diabetes, there's a couple places I think you should go, but the main one is a Facebook group called Type 1 Grit. There's also a book that I think you should look at, Dr. Bernstein's Diabetes Solution. He is a type 1 diabetic himself and wrote the book and uses the low carb diet to minimize his insulin, and now has made it to 80 plus years of age, living very healthily and requiring minimal medication to control his type 1 diabetes. So that was Dr. Bernstein's Diabetes Solution, and then the Facebook group Type 1 Grit. And these are people who are using a low carb diet, low carb approach to control their type 1. If you want to try a low carb diet, I do recommend you have a ketone monitor. We use Keto Mojo here in our clinic a lot, but there are other ones out there. You need to be monitoring your ketones on a regular basis. If you're a type 1 diabetic, you should have a ketone monitor anyways, just because of that risk that's there, and periodically checking those, especially if you get sick or something of that nature. I also think you should be under the care of a healthcare provider. I can tell you your healthcare provider may or may not agree with this approach, and I'm going with they're probably not going to agree with this approach, but you should still be monitored and be under the watchful eye of a healthcare provider, endocrinologist, primary care, somebody who can be monitoring you, make sure you're safe. So I have 2 patients now, I believe, that are type 1 adults, and they are monitoring their ketones and they are using a carbohydrate restricted. I would say they're probably falling into that under 50 grams. And they have been able to really minimize their insulin use, going from a lot of insulin to little insulin. Honestly, they're using mainly basal insulin. That's a once a day long acting insulin shot, and they've gotten away from having to use mealtime insulin. As I mentioned in the beginning, I have many type 2 diabetic patients now that have either been able to come off of insulin or come off of other medications to control their diabetes and just control with diet alone. So I've seen this intervention work personally. I hope that if you have diabetes or someone that you know has diabetes, that they will look into this, because when you are diabetic, you are essentially carbohydrate intolerant. Your body doesn't know what to do with carbs. If you're type 1, you don't have the insulin to control your carbs. If you're type 2, you have the insulin, but you're not listening to it, so you don't know how to break down those carbs and use it. So think of yourself as lactose intolerant. Someone who's lactose intolerant can consume lactose. It's not going to kill them at that moment, but man, it's going to do some bad things. And so if you have type 2 diabetes and you consume carbohydrate, it's not going to kill you at that moment, more than likely, but it is going to do bad things. And I look forward to seeing the further research on this subject so that we can open up nutritional therapies to help everyone with diabetes and to have a better future. And honestly, I feel like sometimes we took a step backwards in medicine when we forgot about that nutritional approach. What would have been better is say, continue that nutritional approach and add the insulin in there. And then we would have more people like Dr. Bernstein, who's living a long and healthy life. All right, I will see you guys next time. Remember, get that virtual ticket here within the next couple of days. If you haven't already gotten a ticket to Low Carb for Better Health, I'm looking forward to it. It's going to be an exciting day. Take care.